In recent months, numerous executive orders have dismantled U.S. foreign assistance and global health efforts. But global health agencies and institutes and global scientific collaborations have had important benefits, including in the United States. I'm Stephen Morrissey, managing editor of the New England Journal of Medicine, and I'm talking with Christopher Duggan, director of the Center for Nutrition at Boston Children's Hospital, a professor of pediatrics at Harvard Medical School, and a professor in the departments of nutrition and global health and population at the Harvard T.H. Chan School of Public Health. Dr. Duggan has co-authored a perspective article about cuts to foreign assistance and global health programs. Dr. Duggan, could you start by describing the major U.S. global health agencies and their mandates, at least as they existed before these changes a few months ago?
The US government actually has a number of different institutions, or did have a number of institutions that were involved in global health. And they, of course, included the Fogarty International Center at the National Institutes of Health, which is responsible for global health training and research. Obviously, the Centers for Disease Control and Prevention in Atlanta, Georgia, which is extremely important for evaluation of both acute and chronic disease pandemics and epidemics. And certainly the United States Agency for International Development, which has been the mainstay of humanitarian and health assistance and government assistance for our government for many decades.
So you say in your perspective article that the establishment of those institutions was driven not only by a goal of addressing global health disparities, but also by political imperatives. So what were those political imperatives?
Speaking specifically about USAID, or the Agency for International Development, that organization was led by the Kennedy administration, but in many ways it was a continuation of post-World War II political initiatives favored by both Republicans and Democrats. Indeed, USAID was started as a bulwark against the Cold War initiatives, wherein other countries were proposing administrative, health, and humanitarian assistance to countries throughout the global South. Indeed, the United States established USAID to counteract some of those initiatives and to help support populations living globally.
And then what effects had that U.S. foreign assistance had on health in low and middle income countries?
There have been many examples of where USAID and NIH and CDC initiatives have helped not just the health and economic development of poor countries, but have had implications for the health and well-being of populations in our country as well, which is really one of the main points of the perspective. Infectious epidemics, for instance, know no boundaries between and among countries. And so any initiative that reduces infectious epidemic risks in countries in sub-Saharan Africa or South Asia have direct implications for the health of our own country. We've seen this in the distribution and implementation of multiple vaccine preventable and vaccine unpreventable illnesses. And we've seen it with respect to gastrointestinal illnesses, of which I'm especially familiar as a pediatric gastroenterologist.
What about global scientific collaborations involving U.S. investigators or U.S. funding? What have been the implications of those relationships for global health?
Again, my experience in the evaluation and implementation of initiatives to improve medical care for children and adults with gastroenteritis have illustrated very well the importance of those scientific collaborations. In the 1960s, for instance, many U.S. investigators supported by NIH, CDC, and private universities lived and worked alongside with colleagues in South Asia to develop oral rehydration therapy. Some have termed oral rehydration therapy as one of the most important medical discoveries of the 20th century. And widespread use of oral rehydration solution has saved literally millions of lives and thousands of lives in the United States as well.
So you've talked about the health effects in this country of these programs. What about the economic effects in the United States of these programs?
Well, it's very well established, and this is talking broadly, not just about humanitarian assistance, but clearly both humanitarian assistance and federal research dollars have a huge impact on the economic well-being of communities throughout the United States. But speaking just of humanitarian assistance, obviously the foreign aid that our country provides to populations globally has implications for our economic well-being. United States citizens are employed by these institutions. United States farmers are providing foodstuffs for humanitarian assistance in areas of the world where food insecurity is a major problem. And the scientific advances that our humanitarian assistance depend on are, of course, supported by a broad range of scientists throughout many states in the United States.
What have been the Trump administration's arguments for cutting these programs?
That's, to be perfectly honest, a little bit unclear because you can argue that all of these steps, as we've just reviewed, are not only not in our economic self-interest, but they're not in our foreign policy self-interest either. Some would argue that foreign assistance eats up too much of our federal budget. But as we point out in our perspective, the actual percentage of the total federal budget for these humanitarian assistance programs is actually quite small, less than 1% of our total federal budget. Indeed, in past decades, the percentage of our federal budget going to humanitarian assistance was much larger, as it was during the heyday of the Cold War.
So you do say in your article that there's some concern that this retrenchment of U.S. foreign assistance could have unpredictable political consequences in addition to the health effects that you've talked about. What do you see as the political and economic implications of cutting assistance and ending research collaborations?
Even before the dismantling of USAID, China and several other countries had been putting their footprint on initiatives for supporting the health and well-being of global populations. And this obviously is an important development for our country politically, and indeed leads those countries to perhaps establish stronger trading policies and relationships with countries that are not the United States.
Finally, what steps can individual clinicians and investigators take to promote global health research and support given this current environment?
Well, I think it's really important to spread the word. Our perspective really pointed out facts that may not have been appreciated by most citizens of this country, namely the health and economic implications of the abandonment of our humanitarian ideals. The more that members of Congress, U.S. senators, and federal representatives hear from citizens who are concerned about these steps, the better. And as we try to point out in the perspective, Republicans, Democrats, independents, all people interested in the well-being of our country should be attuned to these detrimental effects of our current federal policies.
Thank you, Dr. Duggan.